Everybody, good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. Earl Strader, who is Assistant Chief Administrative Officer, as well as Sean O'Donnell from the Department of Health and Human Services. You will hear from them now at the beginning. And Dr. Bridgers our acting health officer will be joining us in just a few minutes. Now, we did have some technical difficulties with a Zoom platform at the beginning of this. So if it crashes and we get kicked out, please join us again. With that, Mr. County Executive, good afternoon to you and welcome.
Good afternoon, and thank you all for joining us again for our weekly press briefing. I'll start with a note on the state of the country. This week our nation went over 700,000 deaths from this virus in just under 20 months. In Montgomery County, we've had a little over 1,600 of those deaths. This is a sobering number. To put it in perspective, 620,000 Americans died during the entire Civil War. This pandemic's become the deadliest in American history, overtaking the toll from the influenza pandemic of 1918 and 19, which killed about 675,000 people. We continue to mourn and think about those who lost their family, friends, and even coworkers, as we have here in Montgomery County. And quite frankly, it didn't have to be this way. Too many families are grieving due to bad policy decisions and blatant misinformation by the Trump administration and those who follow him, and whose influence and incompetence is still reverberating throughout this country. And it's delaying our path to return back to normal life. A month ago, Politico writer Stephen Dennis pondered on Twitter what the nation's death rate would be if the rest of the nation was like Montgomery County. Stephen said 87% of eligible Montgomery County residents home to Dr. Fauci and NIH are fully vaccinated, 95% of seniors. How many fewer deaths if the rest of the country had matched these numbers? And that's a fair question, because what we did wasn't rocket science. It wasn't a secret. We had no magic. There was nothing here we didn't do that everybody else didn't know that they should do. It's just the choices we made versus the choices that other people made. People deserve better than that. And it's a shame that we've had this toll, and we continue to have this toll, because people don't take this as seriously as they need to take it. Today in Montgomery County, our positivity rate is 1.88%. And we have a case rate of 10.85 per 100,000 residents. We continue to be a community with substantial transmission according to the CDC, and our indoor mask mandate will continue until we move out of substantial, and I mean lower than substantial, not high, and we can sustain that for a period of time. This week, 75.9% of our total population are fully vaccinated, and over 83.7% have at least one dose. And again, that's the total population, including all those under the age of 12 who can't be vaccinated. Of the eligible population, we're at 89.4% of those 12 and older who are fully vaccinated, and 98.6% of our eligible population has at least one dose. Those are pretty significant numbers. 96.1% of our 65 plus population is fully vaccinated, and 99.9% have at least one dose. We continue to target our zip codes in the county with the lowest vaccination rates. We are very cognizant of this. We've been cognizant of the disparities from the beginning, and we continue to work at it. There's a chart I wanted to show you. Unfortunately, it's apparently not going to be showable today, but it looks at the different vaccination rates by race and ethnicity. And the Asian and Hispanic groups are now the largest vaccinated and virtually tied with each other. And next is the white cohort, and the African-American group is only about 1% behind the white group. So it was only a few months ago when these groups are when the Hispanic and African-American groups are 18% behind the white group. We've begun to achieve parity, and we just need to get more people in the African-American and white group, frankly, vaccinated. We're now in the fall, and we're encouraging everyone to make sure they get their flu vaccine. Preventing yourself and your family from the flu is important to our overall health efforts. Last fall and winter, flu wasn't as prominent because kids weren't in school. Many of us were staying away from each other and not commingling, not going to work. But with vaccines throughout our community, this fall and winter are going to be different, and the flu will be more prominent. Again, it's not an order, but wearing a mask during the time of flu may not be a bad idea. Stopping the spread of flu is going to be crucial to reducing the staffing shortages, especially amongst our health professions and the hospital staffs. Montgomery County Health Department and Human Services will offer 4 flu vaccine clinics over the upcoming weeks, and you can get a flu shot at many retailers and primary care physicians in the county. This is really important because the flu will send some people to the hospital. We do not need those numbers compounding the number of people who are in hospitals because of COVID. I want to talk a minute about employee vaccinations, since a number of people have gone out of the way to misrepresent my position on this. I want to be clear. Last week when we talked during this media briefing about the council legislation and what would happen to employees if they didn't comply with the mandate, I basically said, I absolutely believe that all employees should be vaccinated. And by the way, that is the message that the union leadership has given the employees. There is no separation between any of us on whether or not everybody should get vaccinated. Just as I believe that all residents should be vaccinated. But I also said the vaccine mandates as they are, I wish that the president and Congress would actually pursue mandating the vaccine across the board in the nation. I was hopeful when Biden, when I first heard about the more than 50 employees, I didn't realize it did not apply to everybody in the country at first. And that's important because as long as there are different policies in different jurisdictions, employees could leave work because they don't want to get vaccinated and find the job someplace else. That, again, that just increases the risk of unvaccinated people spreading this. It just changes the location of the risk. We would be better off if we had a mandate across the board for everyone. And that way the employees would not have the ability to go job shopping if they don't want to get vaccinated. This is important enough to do this. We do this for our kids when they go to school. We go through, a lot of people go through this frenzy in the summer before school starts of making sure their kids have the vaccines they're supposed to have, otherwise they're not allowed in school. And I do wish that we would take a broader approach to this. But I've also never said that I'm opposed to a vaccine mandate. I don't know where people got the idea that I oppose a vaccine mandate. I just said the legislation is premature because we need to assess the impact that a mandate will have on providing basic services to the county residents. Montgomery County government is not a restaurant, I'm not a bookstore, and I'm not a movie theater. If I have to close or you reduce staffing in a restaurant, maybe the service takes longer. Maybe you wait longer at a desk for checkout at a bookstore. Maybe there's nobody to help you. These are inconveniences. But if we're not able to staff the jail fully, and if we're not able to fully staff fire and rescue services, where 80% of the calls that fire and rescue makes are actually health related, not fire related. And if we can't staff the police, then we run the risk of serious consequences. For the years that I was chair of the Public Safety Committee, we were always told how critical the arrival of ambulances was and how critical the response time was. And myself, and I know the council when I was over there, we would always push back against anything that was proposed that would increase response times, because the fire department would always remind us that increasing response times also decrease the survivability of patients, particularly, for example, having cardiac arrest. So this is critical. And what I wanted to know, and I've asked my departments to do this work, is to find out how low we can go in terms of lost employees and still be able to deliver critical services. That's the thing we need to understand before we walk down this path. I would not want to be responsible for not having ambulances be able to respond to a call for a heart attack victim because I don't have the paramedic close enough to get that paramedic there in time. So I have no qualms with doing a mandate, but we need to understand what the consequences might be and figure out how we're going to manage it. And that may take more the amount of time that the council is talking about giving people. And please remember, All of our employees have been delivering these very same services to the public for the last 19 months without triggering any widespread infections as a result of delivering these services. And these are the same employees that we sent out in public to do this work when we didn't even have proper protective equipment. And yet they went out, stood on the front lines, and took care of the population of Montgomery County. So a little forbearance while we work through this. I think I'm a big believer in progressive discipline and continuing to tighten things down, hopefully to drive more people to get vaccinated. But the most important thing for us is to understand what the impacts would be on county services so we know whether this is going to be a safe thing to do or not. To update you on our current employee vaccination status, 85% of our employees have reported their vaccination status now, and 92% of those who reported have at least one dose. And the county and the unions are working aggressively to get the remaining 1,500 employees to report their status while encouraging them also to get vaccinated. We've been able to provide the unions with a list of people who have not reported their status, and they're calling their members and asking them to give the county the information we need. I've also asked, as I said before, all departments to report back to me by next Tuesday on how they see the impacts on their department at different levels of job loss. And hopefully that'll help inform the best decision we can make going forward. Infection rates among county employees are exceptionally low across all departments. Currently, there are only 55 employees that are confirmed positive or in quarantine for an exposure to a confirmed positive case out of 9,509 total employees. We're currently working to implement an ongoing testing program, and our testing program will launch with MCFRS next week, and we're finalizing our testing program with other employee groups by the end of the week. Unfortunately, there are those who cite the limits of testing and haven't asked questions about why we're testing less than we wanted to test. And the answer is pretty straightforward. At virtually the same time we moved to a vax or test policy, the rapid tests vanished from store shelves and they vanished from availability to the county. The federal government apparently bought up a large number of the rapid tests. People have reported, the news reports have talked about the inability to get tests when people go into stores. At the moment we needed the supply was no longer there. And that's been the problem in standing up. We could do PCR tests, but PCR tests are not helpful in deciding whether or not you should go to work in the morning. If I give you a PCR test and tell you to go to work, and then 5 days later I discover when the test comes back that you had COVID when I gave you the test, all I've done is expose people to COVID for 5 days. So we need the rapid tests. We're making every effort we can to acquire them. We will crack this nut, and the federal government has said there's going to be a major increase in supply, and there's another company that has now come into the production of rapid tests. They were just approved by the FDA. They're talking about 100 million tests production a month. So we see the supply beginning to loosen, and we should be able to implement a test strategy. We want to make sure that no one enters the workplace if they're positive. Absolutely no one enters the workplace if they're positive. So that's where we are with that. We will have better answers, at least on what we think it's going, how we think it's going to affect us by the middle of next week, and we'll share that information with the council, and then we can make a decision about what the best path forward is. And I wouldn't be doing my job if I didn't ask these questions. I hope and expect that everybody else would have the similar questions. If you lose ambulance workers, people ought to know whether or not that's going to impact our ability to deliver ambulance services. And until we know that, we ought to make sure we don't make a decision that we're going to regret later on. In terms of other things we've been working on, rental relief, our large rental relief effort for thousands of families has been going forward, and I'm glad to see the progress made in distribution and allocation of rental relief funds that are helping families stay in home and avoid evictions. Earlier this week, more than $27.5 million in assistance has gone out for this round, for a cumulative total of $45.4 million and indirect assistance. And we've led the state in the rate of distribution of funds for July and August. Since May 2020, we've been providing rental relief from our coffers, and we've received over 21,000 applications and prevented nearly 7,200 households from being evicted. Since the launch in April this year of our latest tranche of money from the Federal Emergency Rental Assistance Program, we received over 11,000 applications for this final round of funding. This is substantial. We've done more applications than any other jurisdiction in the state. And as you can see from a chart, which you obviously can't see, that we've received as many applications as all of the other big 8 jurisdictions combined. And that's a testament to the outreach work we've done in the community to make people aware of this program and to get people to submit for relief. Our program's already processed 54% of those applications. Caseworkers are working on another 15% right now. And based on our pace, we expect remaining applications to all be done in the next 3 months. Our denial rate has dropped from 30% down to about 9% with improvements we've made to our process with this current round. And we met our targets that the Treasury sent for spending milestones for our direct allocation. And we're able to submit substantial spending and obligations to the state toward their target. While we probably haven't quite reached the state target yet, we're far above everybody else in the state in terms of moving toward that target. Applications remain open. We know there's a lot more residents that need to apply who haven't applied. We see this when we deal with the evictions. We get a list every week of who's going to be evicted. We call through that list. We identify people who've applied. And for a while, we were running at almost 3/4 of the people on that list had not even applied for assistance. That number has declined, but we're continuing to help those on that list and get them to apply when we find that they're on the list and that they're eligible for assistance. In terms of evictions, there have been 574 households that have writs scheduled for eviction since July 19th. And we've gotten 41% of those households to apply for assistance. Only under 8% of those writs have turned into evictions. So that would be, a little over 40 of those writs have actually become evictions in the county. And that's a good sign that we're getting help to people with these problems early and keeping as many families in their homes as we can. I want to once again thank the Sheriff's Office for their working with our team in HHS to share their information to help us expedite these cases and ensure that as many families as possible can stay in their homes. Finally, this is Domestic Violence Abuse Prevention Month. And I was able to take place in a little ceremony the other day over at the Family Justice Center, and I wanted to make mention of this. Domestic abuse is a scourge in our society that's unfortunately gotten worse due to the impacts and stress of the pandemic. People are literally trapped in their homes, often with their abusers. If you're not able to go to work and your abuser's not able to go to work, you're not in contact with your social network, you're not in contact with people who could help you, and you're often left in the worst circumstances you could be left in. So it's not surprising that the number of cases has increased. On average, there are 20 people per minute who are physically abused by an intimate partner in the United States. That equals more than 10 million women and men a year. COVID-19 pandemic has just made this worse, and Montgomery County residents didn't escape that. As compared to 2020, the number of county domestic violence incidents is 27% higher, which is why it's so important for us to encourage people to get help. If you know someone, suspect somebody is being a victim of abuse, please reach out to them. There's a state 211 number you can call, and there's a 211 state website that has a list of all the resources that are available in the state and in the county. And we encourage people to take advantage of this information. Do not suffer, do not put up with it, and please get help, because there's help there and the county stands by and ready to make sure we can protect you as best we can and put you into a safe setting. Throughout this month, the county and the Domestic Violence Coordinating Council will be conducting virtual weekly events, webinars, and panels with all residents and for all residents to help them recognize instances of domestic abuse and help them identify the resources that they can reach out to and get help from. With all of that, I'll turn this over to Dr. Stoddard.
Is it you who's going to go now, Dr. Stoddard, or Sean O'Donnell? Sean, are you there?
I am here.
Okay. You ready for your presentation? Good with your signal?
Sure. Yes, I'm all good. And I appreciate the county executive, I believe, is hit some of the most important points with where we are as a county with both vaccination rates and transmission rates. We have seen the transmission rates come down a little bit, and our county still leads in case rates across Maryland, but we still need to drive that even lower to reduce the restrictions we currently have. The charts he's mentioned with relation to our racial and ethnic vaccination rates should be available very shortly through the pulse reports on the county website. So that will be available to the public and the press, I believe, at some point later today. We do want to mention that as those rates continue to improve, vaccination rates continue to improve across all of our ethnic and racial backgrounds, we are still seeing some differences in the case rates and the hospitalization rates. And our Black and African American populations are still being disproportionately hospitalized once they have COVID. And we want to continue to emphasize how important it is to continue not only the booster shots, but also those first and second doses to get everyone vaccinated. The one other set of numbers that public health is looking at is those case rates and the hospitalization rates for breakthrough cases versus unvaccinated cases. And where we have 10% of our population that is not fully vaccinated and only 1.4 who's partially vaccinated, we are still seeing that the not fully vaccinated make up more than half of our cases in our county over the last week, and 65% of our hospitalizations. So it's still important for those groups to get vaccinated. The one other thing I wanted to touch on is where we are with boosters and where we are with the pediatric vaccinations. Our state partners have updated their timetable for reviewing these. We know that we are currently providing boosters for the Pfizer vaccine. We're authorized to do that. Those individuals who got Moderna and those individuals who got Johnson & Johnson are wondering when those will be approved. We know that mid-October, October 15th for Moderna, or I'm sorry, October 14th for Moderna and October 15th for Johnson & Johnson, the federal partners will be looking at that booster data. We're hoping that they'll make a recommendation to allow boosters. And then subsequent to that, we'll get direction from the CDC and our state partners which would enable us to begin giving those. So we're looking forward to that. We also know that our federal partners have scheduled October 26th to discuss the 5 to 11-year-old pediatric vaccinations. We're hoping they'll make a recommendation around that time. And then again, our ACIP panel at the CDC will give recommendations of how to go about that. What we do know about the pediatric vaccinations is that it will be a separate set of vaccine that's given out to the local health departments, the hospitals, the other providers. And so they're telling us we can't use our current Pfizer vaccine. It will be a different it'll be a different dosage for the younger individuals, and it will be sent under different packaging. So we've been told we cannot use our current Pfizer dosages, and we will get updated amounts. Everyone who can give vaccine will get updated amounts for the pediatric groups. So we're looking at probably a timetable of early November, possibly first or second week. We hope that this will be authorized to begin giving vaccine to those age groups. And I know a lot of parents are very interested in that. We continue to work with our school partners, as well as our community partners, our minority health initiatives, and our private partners to ensure that all the different partners have access to vaccine and we can get this out as quickly as possible. Those are all the updates we have from public health. And so like to turn it over to Dr. Stoddard.
Good afternoon. I have one additional item I want to touch on. That is our testing expansion in our public schools. So I know it's been much discussed with regard to the implementation of things like Test to Stay. And to be clear, the County Health and Human Services Department and county government is committed to offering that per the request of the Board of Education and the superintendent. So far, we've got 30, I think 31 actually, individuals who have gone through the onboarding and background check process, additional medical staff. They will begin, they'll be doing fit testing for N95s today, and I think some additional training. Then they'll be ready to start operating in the schools to buttress the existing rapid testing programs, get them used to running rapid tests in the school environment, get them familiar with some of the schools, things of that nature. They'll be deployed across the county to try and address those places that have seen the highest testing volume. We have an additional 30 or so individuals who are about to go onto the onboarding and background check process. That takes about 7 to 10 days. So we're hopeful by this time next week, or certainly by the end of next week, that those 30 will be on board as well. We are still working with MCPS on the Test to Stay protocol. We have a meeting with them tomorrow again to discuss some more details on this, and then we'll be sharing it with the Maryland Department of Health for them to review. And we'll also be sharing it once the Maryland Department of Health reviews it with our non-public schools who have expressed some interest in being able to set up something themselves at the non-public schools as well. And so we're committed to doing all those things. Now, obviously, I've described to you we're not going to announce the timeline. We want to make sure that what we're doing in place works. And so I'm not going to commit to a timeline specifically today, but we are talking about, once we get these 60 on board, how we could potentially start beginning this process. And what we've largely discussed is so far a model whereby we would do mobile Test to Stay, focused initially on the larger quarantines, the full classroom quarantines, so we can maximize the use of the resources we have available to us, even as we continue to look, via the contractor, look for more staff to onboard, more staff to background check, and so on and so forth. We've requested so far 100 total staff. And once we get closer to the 100, we have the first 60 on board, we'll make a decision as to whether we need to go beyond 100 as well. The other thing about these staff that is important to recognize is that the way we've designed these contract supporting agencies to work is they will be available to support the school-based testing program, but they will also be available to support the 5 to 11-year-old vaccination effort. And so we've specifically designed the program that way so that we can actually expand rapidly to provide more vaccine once, as Mr. O'Donnell said, the CDC and FDA approve that EUA, assuming that they do in early to mid-November. And so obviously we've given ourselves some flexibility. We do know that the state of Maryland is preparing a 5 to 11-year-old vaccination plan per the governor's request. They have until next Friday to provide that plan to the governor's office and to the secretary. We will see the plan at that point and understand a lot more what our role and what percentage of the vaccine that's coming to Montgomery County will actually go through the local government versus the pediatric providers and hospitals. And so I think once we have that information and we'll have the staffing already lined up, as I've discussed, we'll be in a much better place to understand exactly how many and where the clinics that the county offers will be hosted at, with all the all the description that Mr. O'Donnell described, where we're going to look to spread geographically and equitably across the county to maximize the opportunities for parents. So I think that's as much as I want to go into right now, but happy to answer questions.
All right, thank you, gentlemen. And let's get started with the questions. Number one, Kate Ryan, WTOP. And Kate, I believe you have questions for the county executive and also for Dr. Stoddard. Good afternoon, Kate.
Good afternoon. Thank you very much, and I appreciate it. I think you've answered a number of my questions, Dr. Stoddard, but I did want to check on, in terms of access, once we get the pediatric vaccines available, is there a thought of more school-based access versus county facilities? I know, for example, for the boosters, we've reopened places like Germantown, et cetera, to have more capacity. How much of an emphasis will you put on trying to get these to school-based hubs?
Yeah, so definitely we're working with the schools, both the MCPS and the non-publics. We've asked them to identify it will not be not be possible to do a system where we're having a vaccine clinic at the same time in 134 elementary schools, 40 middle schools, and 100 plus non-public schools. And so we're looking for hub-based. They will likely, very likely be many at school-based environments. What we've asked the schools for, both non-public and public, are larger geographically distributed venues that could serve many children besides just the children that may attend a particular school, public or non-public. And so we certainly will be doing vaccination clinics in schools, but they're not likely to be only targeted to the specific school in which they're being hosted.
Got it. And then in terms of you mentioned 30 people being brought on board or trained and ready to go in schools, and then another 30, which may take 7 to 10 days. Are these described as contact tracers? My understanding is, okay.
It's different.
Okay,
Yeah.
okay. And here's the thing. I understand that the county is looking at 80 contact tracers. Would those people be dedicated to school-based testing only to help with the volume? I would assume that, again, you have 160,000 kids. If we're looking at test to stay, that's a whole lot of tests.
Yeah. So when we're talking about, so it's not 80 to 100 contact tracers, it's 80 to 100 testers or people who are both capable of doing testing or vaccinations. Now, MCPS specifically is definitely bringing in some additional contact tracing elements, but the roles for these testers / vaccinators will not specifically be to do contact tracing, but rather to implement the testing programs that support the contact tracing process. So these testers will be in schools specifically, not the public schools specifically. And what the model we're envisioning now is, from the first 60 or even the first 100, there's, as I described, 134 elementary schools minimally and 40 middle schools where particularly the 6th graders and some 7th graders are not currently vaccinated and therefore have to quarantine. And so we will not be able to assign a team or individual to every school, certainly at the beginning of this process. We don't know that we'll get there by the end. And so I don't think we're going to be able to take quarantines down from whatever the number that MCPS reported yesterday, 375. I know there's questions about the accuracy of that, so I'll just use that number as an example. So if it's 375, I don't know that we'll be able to take it from 375 down to 0. I think we're likely be able to target the full classroom quarantines initially. I think there were a dozen classrooms last week that resulted in 20 plus individuals in each classroom being quarantined. That's 240 of the 375 that could be addressed by doing a test to stay program in 12 specific classrooms. Now, I realize that doesn't get everyone back into the classroom, but it substantially reduces the number of quarantined kids. And obviously, as we get more resources onboarded, we'll be able to further reduce that number progressively throughout the next several weeks and months. So that's our goal, is to do the most reduction in quarantine that we can possibly achieve with the resources that we have. But we're not going to be able to go from not doing test to stay to doing test to stay in every school over the course of a 1 or 2 week period.
Got it. And then for both you and the county executive, you mentioned the tests, and you're right. A lot of folks have seen those quick turn tests disappear from store shelves. You mentioned that there's another manufacturer apparently entering the market. Yeah. And what do you have a base number that you're going to need for the county for the next, month or so?
It's going to depend on how many people we're going to want to test on a regular basis every day. I mean, I personally think, and we've had some discussion on it, I think the test ought to be at the work site, and that a person should take a test where they can be seen taking the test. And if they don't pass the test, they don't go to work. And there shouldn't be any ambiguity about that. I don't know what that number is going to wind up being. I know that the new company is talking about capacity of about 100 million tests a month beginning in December. I don't know what the federal government's going to do with what they've acquired and how they're going to allocate it. But I hope they allocate it to places like us that are trying to manage a return to work, but also trying to do it in the way that keeps everybody safe. But I can't give you a hard number right now. And I don't know if Earl could give you a hard number right now.
Okay. And when you say,
we know we have right now, I think about 800 employees that we know are not vaccinated, and another, let's say about 1,000 that we don't know their status. And to be clear, I expect of those 1,000, we're not talking about all 1,000 being unvaccinated. We're seeing people come in every day over the last week. That we've gotten 160 or so people come on board over the last week who hadn't provided their status, and 50% of them were vaccinated. And so we're seeing that. I would guess that of the 800 who haven't reported, or 1,000 who haven't reported, we're probably talking that 400, 500, 600 of them are actually vaccinated. So my guess is we're probably talking 1,000 tests a week that we would be utilizing for county employee purposes. But I think what we're talking about also is, we're not naive to what's going on in Europe. And I think Dr. Michael Mina has driven this whole conversation from Harvard and other places. Europe, they're sending, there's pictures, I mean, you can all see them on social media of people with 100 kits in their house because that has been distributed to them. I'm hoping that we as a country can get to that point, but certainly we as a county would like to have a ready supply of rapid tests that we could distribute through libraries or rec centers or some other mechanism like that to make them readily available for the public, so that, I think it would be tremendous if Thanksgiving Day or over the end of year holidays, Christmas or Hanukkah, you could take a test in the morning, then go to your family event with the confidence that you're not actively infectious at that point. So that's the kind of thing we should get to as a country, and we're supportive of that in Montgomery County. And we're going to try and acquire the tests that we can acquire to allow us to move towards that goalpost.
Gotcha. And last question. I know, Lorna, there are a lot of people behind me, but last question, because Dr. Stoddard, you mentioned these people coming in now to confirm their status or get vaccinated. Have they explained why the lag to get in the door to you to either report their status or get vaccinated? Is there a rationale that we haven't heard before, or?
It's a lot of different reasons. Many of them have said, many of them are front-facing staff who don't have regular or routine access to computers. Some of them are, those who are unvaccinated just said, I didn't feel the need to report it because I'm unvaccinated and I was going to be tested either way. Some have said, I was hoping to get tested and therefore I didn't report my status, even though I am vaccinated, and I just didn't report my status because I wanted to be tested. And we confirmed to them that even if you let us know your status and you're vaccinated, you're still able to participate. So there's been a variety of different reasons. And, candidly, I think just some people don't pay attention as keenly as others to the messages coming out through email, because that's just not, something that they routinely do. So we're seeing increased compliance, and I think the unions are certainly helping us by directly reaching out to their members to help us.
Thank you. Thank you very much.
Thank you, Kate. Next set of questions, Dominique Maria Monesi, WAMU, and I believe the questions are for you, Mr. County Executive. Good afternoon, Dominique.
Thank you, Lorna. Hi, Mr. County Executive. Thank you so much. Just a quick question. It's only one today, I promise. The question is about, you mentioned at the beginning of the presser about how Latinos and Asian groups have exceeded their white counterparts, I believe, in vaccination rates. Can you talk a little bit about the why behind that? Why do you think we're seeing that? I mean, or Dr. Stoddard, if you have a good why for this, I'm very curious. I know this is something that's a nationwide trend, so I'm just curious to know if you guys had any thoughts on that.
I think that public outreach we did, targeting on the Latino community was frankly astoundingly effective. They found the message, they were able to deliver an effective message. We got it into outlets that were widely viewed by people in that community, and they responded accordingly. So I think, a lot of credit goes to the outreach team. I frankly think a little bit of it is Montgomery County's longstanding commitment to the community, so that when we talk about wanting to help, and people recognize that we are the government, but I think people look at us as a friendly government, not something that's going to threaten them. And we've, demonstrated over the years our willingness to, not let immigration issues interfere with our ability to work with people and make sure they get services they need. So I think we've built a long, trusting relationship, and I think we were effectively able to get the message out. And I think in the case of the Asian community, when I was looking at around the world, that how people responded to this, you would see in a lot of the Asian countries videos of people just walking down the street with masks, going shopping and just going about their business. I think there was a much greater acceptance from the very beginning that this is a legitimate, normal thing you do in order to protect your health. And it wasn't a big lift for them. And I think, we know with the African-American community, there are longstanding distrust issues with medicine in America and how it's historically been involved with the African-American community. Those wounds are hard to heal. And we've been very pointed in saying we understand the history. We know, what the problem's been, but this virus is real and the vaccine is real. So regardless of how else you feel about this in general, this is the moment when you just need to believe that we're doing the right thing and we're doing it for the right reason. You're not being guinea pigs. Nobody's doing anything unethical. This is frankly just to make sure you're safe. And I think in the white population, we're dealing with residual Trump supporters to some degree. People who, think this is a hoax, who think we're going to plant chips in their arms, or they're going to, grow third eyes, or whatever it is they think is going to happen. People have been lied to and misled. And I can't do anything about people who are susceptible to being lied to and misled. I mean, how somebody doesn't look around at this country and the world and see what's happening and seeing the difference between, I don't know, what happens to people who've been vaccinated and what happens to people who haven't been vaccinated. And this isn't an ideological thing. This is just an objective assessment of what's occurring around you ought to tell you that you need to get vaccinated. If that doesn't convince you, I don't know what will.
All right, thank you, Dominique. The next question comes from Brian Sears, a Daily Record for Dr. Stoddard. Good afternoon, Brian.
Good afternoon, Lorna. Thank you very much. Dr. Stoddard, I wanted to ask, I think I have probably three very simple, direct questions that are kind of forward-looking. The first being, I realize that the numbers in Montgomery County and some other areas of the state are coming down, but they're still relatively high compared to a year ago. We also know that roughly a year ago, sort of the third week of October, we started to see the beginning of the fall and winter surge that continued through January. Based on where we are now, how relevant do you think the numbers and the trends that we saw a year ago are, and how applicable do you think they are to where we are right now?
They tell us a bit about what we may see. I'm not sure they tell us as accurately as they it's not a one for one. And what I mean by that is, obviously we have effectively decoupled transmission rate from hospitalization rate with vaccination. And obviously we're hopeful, as we alluded to earlier, that we have a large pool of people, 5 through 11, 105,000 or so in Montgomery County who are going to become eligible for vaccination, that hopefully will keep us lower. But I don't think it's 100% predictive. I do expect as the weather cools, behavior changes, more indoor activities happen, more transmission occurs indoors. It does not take a scientific degree to just understand that the opportunities for COVID to spread will increase as the weather cools.
To that end, some organizations like IHME are taking a forward look ahead at the next 9 weeks. And when you look at the numbers in Maryland, the forecast calls for a range, but there looks like they're putting confidence in in a 6,700 cases per day average by Thanksgiving. How concerned are you that might be? How confident are you that might be a real number for Maryland? And is Montgomery County prepared for that number?
Yeah. So obviously, we've been doing this for 20 months, as the county executive alluded to. So I feel like we're as prepared as anyone in the country is. And I think we've been effective in managing COVID-19 as a general principle. I think that no one's looking forward to any increase. And we obviously have talked about the fact that we are trying to develop tools in our toolkit that don't require some of the harsher, closures and things like that moving forward. And so we've talked about some things in terms of, some of the face covering requirements where, some of the enforcement that we do in the back office settings of buildings, we aren't hyper aggressive in that space. We could be forced to get there if we need to. We've talked about the whole question around vaccine passports and things like that. We've talked, there are other measures that we are certainly looking at to be able to investigate, to understand how do we address COVID-19 in a way that's a little bit different if we do see those increases that we certainly are concerned about. The models certainly, suggest we'll be there to at least some degree. And so, yeah, we have some different tools in the toolbox this year, vaccine being the most powerful of them, but certainly there are others. Rapid testing is another one that I'd really like to see us get on board more as a country to deal with what we're going to see over the next 3 months.
Last question related to the modeling. Again, going back to the IHME numbers, they're looking at, along the same time period, reaching by Thanksgiving, 1,900 total hospitalizations in Maryland, roughly 400 ICU beds. Given the state of healthcare and the staffing shortages, and just the general issues related to having done this for roughly 20 months, what concerns, if any, are there that hospitals are equipped to handle one more surge?
Candidly, I have a lot of concerns about this, and it's for reasons that you've illustrated, but some that you didn't. Number one, staffing at hospitals is incredibly tough to come by right now. You'll see a huge disparity between the number of physical beds and the number of staff beds. And I realize staff beds tends to fluctuate as volume comes in. They don't staff beds to have them sit there vacant. That said, staff, we're trying to recruit nurses now. We've been trying to recruit nurses for well over a year, really pre-COVID, but COVID has really exacerbated it. It is hard in healthcare because we've, effectively run our healthcare system into the ground as a nation because of these continued waves and refusal to get vaccinated and all those things. And it's taking a toll. In addition, we were closed a lot last year. We had a lot of restrictions in place as a country, and certainly as a county, that kept people not going to bars and restaurants. And what that effectively did is we reduced a whole host of things. Flu was essentially non-existent last year, or very minimal. We were down on traffic accidents. We were down on a whole host of other medical conditions that would normally show up in our hospitals. Now we've got COVID, which is a small percentage, maybe 5, 6, 7% of our hospital beds. But unfortunately, on a given year outside of COVID, 5, 6, 7% is all we really operated with during the winters, when flu was higher and other things were running at much more higher levels. So I think we're going to be in for some tough periods with our hospital setting over the next 3, 4, 5 months. I will be thrilled to be wrong on that, but we've already seen a number of yellow alerts, which are essentially high volume alerts, and we've seen a number of blue alerts, which is the county saying you're all a high volume alert, so we can't not take people to the hospital, so we're ignoring your status. And this is earlier than we typically see those. We see them in bad flu years for sure. Just to be clear, it's not like it's a unheard of thing, but we're seeing them earlier than I'm used to seeing them, and that makes me nervous about what we could see in a month or two.
Okay, thank you, Bear. Brian, the next question comes from Brian Rembaum, MarylandReporter.com. Good afternoon, Brian.
Good afternoon. Question for the county executive. You said earlier it might be easier, if the federal government were to simply just mandate, vaccine requirements. I was just wondering if you could expand upon that and how you would see that working. Should it be for everyone or select populations? Or I know they've done it as far as with federal employees, but how would you see this playing out?
I would do for everybody else what they've done for federal employees. I wouldn't make a distinction. The thing that would make this work is that we have people who are saying, well, their jobs, like you're a nurse, you could be a nurse here, but there are lots of places that are looking to hire nurses. You might say, okay, so fire me, I'll go someplace else. We know that police are in short supply in jurisdictions, firefighters are in short supply. There are a number of jobs where it's hard to find people to do that work. And so you could threaten people with firing them, but it doesn't mean they're going to say, oh my God, that's the end of the world. The moment it becomes mandatory, then people just realize that this is what you're going to have to do if you're going to continue to work. And I'm sure most people will choose to work. And that should get us to the point that we're not dealing with this. It is, I saw this on somebody's Facebook page the other day. It was one of these forms that you got in 1954 or 56 for getting the polio vaccine. I don't remember the form because I was like 5 or 6 years old when I got mine. But But just seeing it just reminds me about how there was no national crisis over getting people vaccinated against polio. Everybody acted like adults. Everybody said, let's keep our children and our families safe. And people went out and they got their vaccinations. And there was this nice little card, and you had the date of when you got the vaccination, and it certified that you were vaccinated. We ought to have the same kind of collective courage to face this thing together and deal with this together, and just acknowledge this is one time when, political party and political beliefs shouldn't interfere with this notion that we have a collective responsibility to do things that keep everybody safe. And I think people don't fully understand how viruses work. So, I hear all the time, this is my choice. This is, my decision, which is your decision until you decide to walk around in the outside world among other people who would like to make a different decision, as in, I don't want to get sick. But that right of your decision turns into your right to expose other people to this. That's a misuse of the concept of a right. And I do believe this is a case where we have a collective responsibility to each other to do the right thing so we don't spread this and keep this alive. And I think people need to understand this damn thing mutates. And the problem we're not dealing with the original COVID virus. We're being bedeviled by Delta. There's a myriad of other ones out there that already have been assigned Greek alphabetical names. And the more this thing mutates, the greater the possibility of getting a version of it that is more vaccine resistant, which is the last thing any of us want to do. I don't want to go back to day one where now what do I do? Because I've got another virus that everybody's going to have to get vaccinated with a unique vaccine. And then we're right back into the madness again. I don't want to close businesses again. I don't want to wreck the economy again. I don't want to look at these death tolls again. I think people need to sober up and do the right thing.
Thank you, Brian. And then we have another question coming from Joe St. George, FHG Media Enterprises. Good afternoon, Joe.
Thank you. I have three questions. My first question is for County Executive Elrich, and it's with regards to if you have any position on whether or not the proposed mandate, I understand your position on timing, and I value your sensitivity to timing, but with regards to religious exemptions, should it include it? And the reason I ask is because there are religious groups that already live restricted lives. They have, Hindus, Buddhists, Muslims have dietary practices that are plant-based, and there's a lot of data around, or 3 studies that show that plant-based eaters have a 73% reduction rate of COVID severity. They don't drink, smoke, they don't do it, their lives are restricted already. And so my question to you is, are you open for religious exemptions for those who, say, hey, I don't want to take it for religious reasons because I have a restricted life and it has afforded me a very good health in the midst of this pandemic?
Look, 73% reduction in severity is great for you, but it doesn't mean that your less severe illness doesn't still contain viral particles that you can spread to somebody else. And so if you're working in a non-restricted world and you're working with other people who don't have the health benefits that may come from whatever your dietary or religious practices are, you're still putting other people at risk. And that goes back to what I said before. This is one of these things where it's just not about me. It is, I am not the center of the universe in this. I am intimately tied to, a whole web of human beings, and the decisions I make, if they potentially put other people at risk, I probably shouldn't be making that kind of decision. But, I think at the end of the day, the courts may well rule that religious exemptions are legitimate, or not granting them would be not legitimate. I'm not a lawyer. I don't know exactly where the state of law is on that. And I'd be concerned, we're clearly not going to do something that someone's going to declare unconstitutional. But I just wish people would look at the broader picture.
My question to Dr. Stoddard is, are there is there any thought about, plant-based lifestyles, laws of health? The Hindus follow a lot of health practices. And those studies don't just focus on the reduced severity, but those two other studies also focused on, and because they were done in the healthcare setting in 6 countries, wherein they said they reduced the spread and them getting it also. And so you talked about tools in your toolkit. And my question is, would you consider entertaining training on changing dietary habits? Because one thing that has come out in the data is that chronic disease, people have comorbidities, especially in the Black communities, is really the underlying driver for this virus. And I would say any virus that comes into our nation. Those populations are already vulnerable, but they have tools like changing their diet and lifestyle to reduce those chronic diseases. So would that be considered another tool in your toolkit that you would consider? Because I understand that the COVID relief money does include training in the workspace and teaching people how to do better with their health.
So certainly underlying health conditions are one of the larger predictors for negative COVID outcomes. And so leading a healthier lifestyle and, routine preventive medical care and all of the things that you're sort of alluding to are good mechanisms to avoid, lessen your chances for a more severe COVID outcome. I do think, as kind of executive said, though, that the evidence is far more complicated when it comes to whether your underlying healthcare condition status would make you more or less susceptible to transmission to other people. And it's a communicable disease. So it's not an exclusive focus on your own individual health. But when we talk about public health, it's you in the context of the society. And I think that's the thing that, I'm not as familiar as you are clearly with some of the research and in terms of prevention of transmission. I don't know the mechanism by which that would necessarily work, but I certainly think we could, take a look at it.
So would you consider it then in combination? Because I believe the COVID task force at the federal level said that.
I got a question in here, Joe. Are you a member of a media?
Yes, I am for FHC.
Okay, one last question, because we do have a cutoff. The county executive needs to move forward to another meeting.
Absolutely. Just with regards to, the collective use of testing and different strategies. I think you talked about them as toolkits, everything working synergistically together to address this, this pandemic. And I think any other pandemic that comes, testing and lifestyle and masking, all of it together. Do you see them as a collective strategy?
Certainly. So I think we've talked a lot about, and it's often referred to as the Swiss cheese model of protection. What that means is that no singular method is 100% effective at preventing COVID-19 transmission or the negative consequences of transmission. That includes vaccination, masking, testing, et cetera. But what you do is, by layering a series of imperfect but effective measures together, you greatly increase the efficacy and the likelihood that you'll be protected, your friends and family will be protected, and your community will be protected. And so I certainly think that, testing, healthier lifestyle, preventive medicine, masking done collectively are important tools in a toolbox of disease mitigation and risk reduction.
All righty. Thank you very much. Thank you, Joe. Thank you, everybody, for joining us today, and stay safe. We'll see you next week. We do not have any more questions from members of the media. And I know, Mr. County Executive, you got to go. So thank you for joining us. Have a great afternoon. We'll see you soon.